Hello everyone, it's me Dr. Zainab and I hope you're having a great day. Today I'm here with our new topic, that is the sinuses of pericardium. In previous lecture we talked about the fibrous pericardium, serous pericardium and the pericardial cavity. Today we are here the sinuses of the pericardium. It is unlike that sinus which you learn in surgery, which is a blind tract between an epithelial tissue and connective tissue. It is unlike those sinuses. These sinuses are basically the impressions in the pericardial sac which are formed by the points where great vessels enter into the pericardial sac. As you already know that heart is surrounded by the pericardium and heart contains major vessels. Some of them comes out from the heart and some of them goes into the heart, like superior vena cava, inferior vena cava, ascending aorta, pulmonary trunk, etc. So these sinuses are basically the impressions of those great vessels. Okay. So here we have overall we have three sinuses in the heart, but as one sinus, that is the superior sinus, is not in our access. Okay, only we have two sinuses, that is the transverse sinus and the oblique sinus, which are accessible from electrophysiological point of view. Okay, the third one, superior sinus, is not accessible. So transverse sinus, if we talk about the transverse sinus, so it is basically a horizontal gap between arterial and venous ends of the heart tube. Okay, I will show you the diagram, but first of all you must know that it is basically a horizontal gap between the arterial and venous ends of the heart tube. Anteriorly it contains ascending aorta and pulmonary trunk, while posteriorly it has superior vena cava and left atrium. If we talk about the other sinus, that is oblique sinus, so it is a narrow gap behind heart. Okay, behind heart there is a space, there is a gap which is called oblique sinus. Okay, anteriorly the oblique sinus contains left atrium, while posteriorly it contains the parietal pericardium. So we have these two sinuses, that is the transverse sinus and the oblique sinus. In this diagram you can see that we have this transverse sinus. Okay, you can see in this diagram that anteriorly it contains ascending aorta and the pulmonary trunk. Okay, the red ascending aorta and the purple with pulmonary trunk, while behind to that or posteriorly it contains superior vena cava and the left atrium. While here you can see it is oblique sinus. Okay, it is transverse pericardial sinus and it is oblique sinus. Oblique sinus is, as I told you already, it is a narrow gap behind the left atrium. Okay, so here we have the left atrium, behind that we have oblique pericardial sinus, and behind to that we have the parietal pericardium. Now what is the significance of these sinuses, that is the transverse sinus and the oblique sinus? As the transverse sinus is a gap between arterial and venous ends of the heart tube, so it helps to identify and subsequently it helps to ligate the great vessels during coronary artery bypass grafting. Okay, CABG, CABG or CABG, it helps to identify and ligate the great vessels during coronary artery bypass grafting procedure. While the oblique sinus, it provides a space for the expansion of the left atrium. So these are the sinuses along with the significance of the sinuses. If you have any question you can ask. Thank you so much.